just mentioned them, and I think you can give them a round of applause. PS Kenya, who supported us. Amref Kenya. The Nairobi Hospital. BSP for Health. The Health Hub. Fanam all the way from Brazil. There he is, Fernando. Stand up. He's come from far and wide to support. Pathologist Lancet Kenya. Thank you. CFC Stanbic Bank. AR Healthcare. Philips Healthcare Technologies. Gold Star Network. The Avenue Group. Clap for them. Aetna and Executive Healthcare Solutions. Kenya Pharma, a USAID project. Medihill Group of Hospitals. Anywhere. And Smart Applications. All of them have done a wonderful job by giving us a superb exhibition. Don't you agree? Give a round of applause to them. One of the key things that make the conference really special is the content. These are fine, you can come for good dining, you get special ceremonies. Andrew can do a book signing, which was really elaborate and fun. The content of the session actually matters. I would like to now recognize and request the session leads of our conference to please come upstage. And I'm going to just read the names out. And they are the ones who have already made this a rich conference, and tomorrow you're going to get really deep content coming in. Can I please invite Dr. John Tolle, Alain Wachner from Germany, Dr. James Mwazia, Kwasi Bohane, Biju Mohandas. If Biju is not there, can I have Bernard? Dr. Jacqueline Kitulu, Rachel Waireri, Onyango, Dr. Lenny Bazira, Felix Olale, and if Felix is not there, can I have Nicola up on stage? Chris Jones. I think it was already a late night for him, I saw him walking. And Dr. Kanyenje Gakombe. Ladies and gentlemen, these are the 11, a team of 11, which is better than any football team that you'll find. It's stronger than anyone that's going to Brazil. But these 11 session leads have worked behind the scenes and worked with the speakers and the panelists to put the session together. And they're the ones who are going to give you deep content, supported by the rapporteur team that we have. Why don't you put your hands together for the session leaders. There are 2 or 3 special awards that we'd like to recognize. And one is a special award that I'd like to give to the team Nigeria. So can I ask Aidele Benson, please come up and receive a special token of appreciation from us.
Thank you, everyone. We We are particularly honored to be a part of this occasion. I want to thank the Kenyan Healthcare Federation and the organizers of the conference for inviting us and giving us all the support we needed to get here. We have learned a lot from what we have seen, and we want to use this as a launching pad as well to go and replicate the same in Nigeria. Thank you for having us. Thank you.
Wow. Hello, everybody. As you may know, I am representing HandShep, which is a much larger group of donor agencies and developing country governments, not all of whom could make it here tonight. So thank you on behalf of African Development Bank, the Gates Foundation, DFID, the World Bank, the IFC, BMZ, USAID, Rockefeller Foundation, I hope I haven't forgotten anybody, Government of Nigeria, Government of Rwanda, and the Public Health Foundation of India. But this has been a very inspiring occasion, and I'm being very pleased to be part of it. Thank you very much.
Finally, a big thank you to all the other partners that have made this event possible. And the partners include Envision. Give them a round of applause. Envision. KEPSA, Kenya Private Sector Alliance. East African Business Council. Eastern Africa Association. The German Chamber of Commerce. The German Healthcare Partnership. NOPEN. And finally, the Business Advocacy Fund. Ladies and gentlemen, there you have it. The entire list of the corporates and organizations that have made EAHF 2014 a reality. A round of applause to all of them. It's my pleasure now to ask Ron Ashkin from PSP for Health to come and share with you just a few words about this innovative program that I believe you all will be very excited to hear. Ladies and gentlemen, put your hands together for Ron.
So thank you to Amit for putting together a wonderful conference, much exceeding all of our expectations. I want to tell you a little bit about the UK government's research project in Kenya called PSP4H, the Private Sector Innovation Program for Health. We're funded by DFID, the UK government's aid agency, and we're here to inform DFID about future program design. So we're kind of the inverse of the typical donor-funded project. Instead of the donor telling us what to do, we actually are mandated to tell the donor how to design future programs based on evidence coming from the field. Now our mandate is threefold. It's to deal with pro-poor populations, it's to deal with the private sector, and it's to deal with for-profit enterprises. So we have kind of a unique playing field. In order to work with PSP4H, you have to be in all three domains. So it has to be pro-poor, private sector driven, and for-profit. Now what we're doing is researching a specific methodology that uses a market systems approach, and how we do that is by primary market research, secondary literature research, and mostly through action research. So we partner with private sector organizations that have innovative models that they'd like to test. Basically, we offer an opportunity to test out ideas that may or may not have marketability. But right now, it's too risky for you to guess, and it's too expensive for you to pay for it yourself. So we operate as a technical assistance or consulting agency. We're not a funding agency. We don't give grants. We actually come in and do technical assistance as a consulting firm. And we're looking to reduce risk, to introduce innovations, and basically get the private sector more active in pro-poor areas where they may not operate without our assistance. So we encourage private sector organizations that are looking at pro-poor expansion to work with us. You may have the imperative to take your business down market to working poor populations. You may even have the investment funds, but the model is not there yet. We want to look at experimenting over the next 12 to 18 months on things that actually work. and then spread the word to the community of practice and the donor community. So let me take a couple words and just show you some of the things we found in our preliminary research. We're mostly working with the informal sector, or what we call the working poor populations, but actually we've discovered that there's a poverty penalty. Right now, most of the working poor pay out of pocket for their health care. So the money's already being spent. But they actually pay a penalty. They pay a premium for the service they receive, because it's usually a four-step process. First, the working poor self-medicate. They don't want to miss work, so they pay the first time by going to the informal medicine shop in the neighborhood. Well, when that doesn't work, they take the second step. They visit an informal provider, so they're paying a second time. Well, when that doesn't work, they finally decide they have to get some formal treatment. And depending on who it is and where they are, it's either the private or the public sector. And then when the treatment starts to take hold, they're probably pretty advanced at that stage, they have to go back again. So it takes 4 visits to solve the problem. Each time they have to pay. So the working poor actually pay more for the same level of service. There's money on the ground right now for the private sector to pick up. It's a matter of organizing the finances. It's a matter of better access and better quality delivery. Now, we did research in 12 counties in December. So we had focus groups. We talked to almost 1,000 working poor consumers. And what we found was there is a preference to the private sector. Why? It's mostly about service and quality. Nobody talked about price because they're spending money already. So the money is there again. What the private sector needs to do is focus on things like confidentiality, convenience, speed of service, availability, access to equipment and medication. So these are the advantages that the poor already know come from the private sector. And we also identified some areas that are just untouched right now. The poor consumers themselves told us they're not receiving any service. The big area seems to be non-communicable diseases. And we know the next wave, what's coming worldwide, is an epidemic of NCDs. We've got cancer, hypertension, diabetes, all these things right now nobody is serving in terms of the working poor population. It's an opportunity for the private sector. Dentistry, another area that's almost untouched for the working poor. Services for the elderly, respiratory infections, occupational health, these are all areas that are wide open for the private sector. Nobody's serving them right now. So if there are any organizations that are interested in action research, actually produce evidence that will go to the wider donor community about intelligent program design in the future that involves the private sector in a profitable way, I encourage them to contact PSP4H. And again, I'd like to thank Amit and the organizers for a wonderful event, and thank you for your attention at this late stage.
Thank you, Ron, for the wonderful remarks. You must be wondering why Jean is upstage. Ladies and gentlemen, the key announcement. EAHF 2015 will be hosted by Rwanda. So put your hands together for our host.
Thanks, Amit, and thanks for KHF. It was very marvelous. It is a very nice meeting, and so I say Karibu in Rwanda next year. The date is not precisely, but I think maybe around March, April next year. And Amit, I have something to ask you and your team. You made a very good job. And I want to tell you if it's possible for you to come and help us to continue your incubation. Because they made a good job. So I think we still need the support for the next year. And thanks a lot. And once again, I say thanks to EAHF. Thanks for East African KHF. Okay, thanks all. Good night.
You're in control, is there anywhere you wanna go? You're in control, is there anything you wanna know? The future's for discovering, the space in which we're traveling. Surface trying to break through, deciphering the codes in